More concerns tonight about the shortage of family doctors in Ontario. People from right across the province tell us they've been on wait lists for 5, 6, even 10 years in some cases. Obviously not a new problem, but a worsening one as more physicians retire and fewer medical students choose family medicine as their specialty.
For a good 6 years of my life, every time anything came up with me medical-wise, I had to go through health clinics and things like that.
Delaney Dunkley was on the hunt for a new family doctor after moving across the province to Kitchener-Waterloo for college in 2016. She ended up on a wait list for 6 years and had no luck finding one. In that time, she had 3 different surgeries for a number of health complications.
Not having the reliability of a family doctor was a bit of a pain because every time you go to someone, it's, "Here's my entire history top to bottom," and you have to figure it all out in, 15 minutes before they're rushing you on to the next person in their practice.
She only ended up with a doctor this year through her newborn baby.
After Theo was born March of this year, the hospital appointed a family doctor through their connections. It was very frustrating, but it was one of those things that it's the norm. So, you can't really get mad at it because that's the standard that everybody's going through. So, you don't really take it personally. The frustration is definitely there, but it's one of those things where it's in some ways kind of sad that it's the life that we live right now.
She's not alone. Ontario's COVID-19 Science Advisory Table calling it a primary care capacity crisis in their final report released earlier this week.
The crisis is here. We are already in the crisis. I feel for patients who are already struggling to find a family doctor. Keep looking.
1.7 million Ontarians could lose their physicians to retirements by 2025, and as of 2020, 1.8 million Ontarians were already without a family doctor. Melissa Knapp is one of them. She's been on the wait list since 2015.
At the time, I had 3 children. I now have 4 children. It was, I guess, really frustrating, when they had to see a doctor and then you had to go to a walk-in clinic and it was busy and you had to wait for hours.
She's losing hope after hearing a declining proportion of medical students are ranking family medicine as their first choice of specialty. And in the first 6 months of the pandemic, double the usual rate of doctors closed their practices for good.
The pressure on the existing doctors is really hard, and they're just scrambling to get through everyone. So yeah, it makes me a little bit nervous for the quality of life for my children.
The science table says one solution is to retain the existing primary care workforce by supporting them through team-based care. That would include nurse practitioners, mental health counselors, and other specialists to share the workload of caring for patients. The shortage is already putting real pressure on the strained hospital system. Sick kids announcing this week their ER wait times have increased significantly. The Ministry of Health tells us in a statement since taking office, the government has added more than 1,800 doctors in family medicine, and they say they will add another 6,000 healthcare workers to the system in the next phase of their plan.